All right, we're going to talk about dopamine hydrochloride, dopamine, also known as inotropin. Now, it's a sympathomimetic. So remember, sympathomimetics are going to mimic or mock or imitate the sympathetic nervous system. We've got alpha and beta receptor qualities here. We're going to give this to folks that really have a low blood pressure. Now, if they're in cardiogenic shock and they have low blood pressure, we're going to give this medication, make the tank smaller. Remember, if we have a low blood pressure, it's either a pump problem, a tank problem, or a fluid problem. And this time we're giving this medication, we're making the tank a little bit smaller, hoping that the blood pressure raises. Now, I can give this to other types of shock, but if it's hypovolemic shock and they still have a bleed, that's not really going to be the best sequence to approach this. I got to stop the bleed first, and if they're hypovolemic from, let's say, 3 or 4 days of nausea, vomiting, I got to do the fluid replacement before I start making the tank smaller. Some contraindications: if I already had some pre-existing tachydysrhythmias, if my heart rate's already up there, 140, 150, might want to figure something else out first, see if there's another pathology going on before I decide to make the tank smaller. And again, I want to make sure I've corrected any hypovolemia that might be existing in our patient. Other things the patient might feel, might have some, as far as adverse effects, possibly a little bit of like anginal type of chest pain, feeling that heart race up a little bit, possibly some nausea and vomiting. And this is going to raise the blood pressure, but sometimes it raises it more than we wanted or more than we intended, so we got to keep an eye out for hypertension. I want a clean dose we want to stick with, American Heart dose, 5 to 20 micrograms per kilogram per minute. So I've got to get a patient weight. I'm going to get my dopamine. It's usually packaged, 400 milligrams and 10 milliliters. I'm going to get a 250 bag, put the medication in the bag. I'm going to use a 60 drop set, and I'll do my med math to calculate the right drip rate. Again, 5 to 20 mics per kilogram per minute. I want to get that blood pressure over 90, and when it's over 90, I'll titrate to effect. Now, one thing I want to suggest to you is, if you're given 10 mics per kilogram per minute and it worked too well and the patient's starting to become hypertensive, sure, we can cut it back a little bit, but always know what we're giving the patient. We cut it back from 10. I don't want to just walk in and say, I'm giving a little bit less than 10. Okay, 10 was working too well, so now I'm giving 8 mics per kilogram per minute or 6 mics per kilogram per minute. Always know exactly what we're giving to our patient.